Greetings and welcome to another episode of Two Bald Guys. My name is Dave Anderson, the Senior Policy Fellow at the Wisconsin Institute for Public Policy and Service, otherwise known as WIPPS. Today we have some fantastic guests who will be discussing the Voices of Wisconsin Students Project. Eric, it's great to see you this morning.
Yeah, good to see you too, Dave. My name is Eric Giordano. I'm the Executive Director of WIPPS. WIPPS is a unit of the University of Wisconsin system. We were founded in 2007 with a mission to educate and engage citizens, develop future leaders, provide research-driven solutions, and bring the resources of the university to address community-identified needs. Now, Dave, there's been a lot of news lately about the Green Bay Packers, and I know you're a big Packers fan, and I can only imagine how hard it is for you that Aaron Rodgers is reported to be unhappy as the Packers quarterback. So I was thinking that I guess you could say his future is in jeopardy. Get it?
Yep, I got that one. And actually, Eric, speaking of jeopardy, the answer is to get a quarterback. To get a quarterback. What's the question?
I don't know, Dave. What's the question?
Question is, why did the football coach go to the bank? To get a quarterback.
Okay, well, on a positive note, Dave, you can rest assured that you have a friend in me, because no matter how bad your jokes are, I'm still willing to be seen with you in public. So I am obviously a true friend. Speaking of being seen in public, it is my pleasure to acknowledge and thank our hardworking producer, marketing specialist, chill hop DJ, and token representative of an attractive younger generation, Luke Rudolph. Greetings, Luke.
Hey, gang.
So profound as usual. Thanks, Luke. By the way, if you have a joke or pun to share or a comment or question about the show, you can share it on the Facebook chat section, or if you're watching the podcast later, you can email us at info@wipps.org. That's info@wipps.org. And I think that means, Dave, that we're ready to get to today's guests and topics.
Absolutely, Eric. And yeah, we've got a lot of ground to cover today, so we want to get into the meat of it right away. It gives me great pleasure to welcome our guests for today's show, entitled The Voices of Wisconsin Students Project. Our guests include Kate McCoy, a research and evaluation consultant at the Wisconsin Department of Public Instruction, Linda Hall, director of the Wisconsin Office of Children's Mental Health, Jason Cram, Children, Youth, and Families Section Chief for the Bureau of Prevention, Treatment, and Recovery in the Division of Care and Treatment Services at the Wisconsin Department of Health Services, and Sharon Belton, the WIPPS Research Partners Director and Principal Investigator of the Student Voices Projects. Welcome to our show, everybody.
Thank you.
Jason, good to see you. Kate, Linda, welcome. Sharon, we're going to jump right in and ask you to tell us a little bit about how the Voices of Wisconsin Students Project came about, and a little bit about its goals and why the study was done.
Sure. Well, thank you, Dave. Thank you, Eric, for having us on today. First of all, while I have the pleasure of talking about the project today, this really was a collaborative effort. It was supported by the Wisconsin Department of Health Services with funding from the Centers for Disease Control and Prevention through an Overdose Data to Action grant. And it was developed over many months with the input from many partners, including the Department of Health Services, the Department of Public Instruction, the Wisconsin Office of Children's Mental Health, the Medical College of Wisconsin, and the UW Extension. And the background for this project really has its roots back in the summer of 2020, when the Department of Health Services received an inquiry from UW Extension about looking for more information about how Wisconsin students were experiencing the pandemic and what their perspectives were about what they were experiencing during COVID-19. And this was right about the time when kids were starting to go back to school. And there were a lot of policy discussions taking place about return to school and what that would look like for kids. And the reality is there was really very little information available, particularly about how students in middle school and high school ages were experiencing COVID. there has been a number of surveys conducted of college-age students and parents and teachers, but at that time there was very little information known about how adolescents and teens were experiencing the pandemic. And at that time, WIPPS had just done a project specific to Marathon County that had successfully looked at Marathon County students' experiences. So we were able to use that methodology and approach that we had used in Marathon County and expand it statewide to really understand how students were coping with school, their learning environments, and life in general. And so we had the pleasure of working with, many of the guests that are on the Facebook live stream today to move the project forward, earlier this winter.
Just a real quick follow-up. Have you seen anything like this study in other states or nationally?
To the best of my knowledge, I'm not aware of any study like this that has comprehensively and systematically looked at students' experiences with COVID, particularly at this age group, using a focus group methodology. And the benefit of the focus group methodology, as opposed to, say, a survey, is that we were really able to dig more deeply into how students were experiencing the pandemic, what their concerns were, what the nature of their concerns were, basically capture information that is very difficult to gather through other data collection methods such as surveys. So as far as I know, this is the largest and most comprehensive study of this type that's been done, certainly in Wisconsin, and as far as I know, anywhere else in the country.
Cool.
Well, thanks, Sharon. And Sharon, I'm going to stick with you for one more question, then I promise I'll get to our other guests here. But I wondered, as the principal investigator, you're probably in the best position to just talk about a couple of key takeaways. Now, I know there's a lot in there, so maybe just stick with like one or two or three, just top takeaways from the study.
Sure. I guess I'll focus specifically first on students' learning experiences, because I think that we got some interesting perspectives from students on their experiences with learning. And at the time that we did the study, which was in January and February this year, about 3 out of 4 of the kids that we talked to, and we included about 160 kids from across the state of Wisconsin in the project, the vast majority of them at that time had been learning in some kind of virtual or hybrid learning environment. And while it was very clear that the students that we talked to had experienced some significant challenges with their virtual learning, particularly, very substantial increases from their perspective in their workload, some difficulties in accessing their teachers for help with their learning, just challenges with managing their time, and just overall staying motivated, with respect to school. I think it's also important to point out that many of the kids that we talked to, regardless of whether they liked virtual learning or not, could identify some very positive aspects of virtual learning or their experience with school during COVID that they could identify. For example, many of them appreciated the increased flexibility that came with virtual learning, the ability to work at their own pace. They could take breaks when they needed. Some of the middle school students that we've talked to really liked being able to step away from their computer or their MacBook or their Chromebook and just spend a few minutes with their pets to try to, just take a little bit of time to get refreshed and remotivated to go back to learn. A lot of them liked being able to spend more time on certain subjects and maybe less time on other subjects. They noted that they had more time to pursue hobbies and activities. The ability to sleep in was really appreciated by students at both the high school and middle school levels. And many of them really appreciated having a lot of flexibility to their days. So I think it's very clear that many of the students that we talked to were struggling and have struggled during the pandemic. But I also think it's important to point out that despite those struggles, a lot of them could find some benefits associated with trying to learn in a virtual environment. And many of them hoped that some of those benefits could be retained as they continue to move forward with their school experience.
Great, I appreciate that. And we're going to get into some more detail here right now. And Kate, I'd like to turn to you for a minute. Are there some key points from this project that you think are especially relevant for schools and school leaders as they seek to support students in their learning, especially going forward?
Yeah, thank you so much for that question. I think there's a lot in here that's relevant for schools, and I will highlight what my takeaways are, but I would say other people reading the reports might come away with other takeaways because it's very rich. And it's also, I know school folks are so busy. This is a page turner. This is very valuable information because you're hearing the student voices, and the information is so well organized. So that's a pitch, to draw your own conclusions as school folks. But what I had as takeaways were three things. So one, if I were running a school and reading this report, I'd be thinking about centering connections and relationships. Two, dialing down the stress going forward. And three, explicitly demonstrating resilience and learning through this experience. Sharon already talked about the fact that there are some great lessons, positive lessons to come out of this, and sort of calling those out and demonstrating those explicitly for kids and staff. So just quickly, with relationships, we know from the literature, we know from the research that strong relationships, student-teacher relationships, peer relationships are so important, not just for mental health, but also for learning. And of course, that's what we see in this report, right, is when those relationships are lacking, people suffer. And if you're a parent and or an educator or a student, you've lived through this time, you don't need to read an academic piece to know that. We've just seen it in real time. And so I think one of the opportunities and challenges going back into a more normal school situation is how do we keep those spaces open for valuing and nurturing those relationships, those spontaneous moments, those connections that are really the glue that so many keep school communities together, keep educators in the field, keep kids engaged. I mean, this helps with attendance, behavior, grades, graduation. So if you're playing the long game, relationships have to be front and center. I think everybody believes in relationships. The thing that can steal from it is stress. And some stress is good. Before COVID, we were seeing very high levels of stress and anxiety from students. So we saw that in our own data. I've seen that in many other studies, and we hear it. We were hearing it from both educators and students. That was pre-COVID. And then you do hear that stress in a lot of what kids are talking about in the report. And one of the things that really struck me was reading about the kids who are learning virtually part or all of the time, who are having a bigger workload than they had in the past. And I've seen that verified in other places. And I think some of that might have been stress driven on the part of some of the teachers worrying about, demonstrating that they are teaching or making sure that they're going to help make up for that lost instructional time. And I know those narratives of, we've got to make up for this time can really, that can really be leading some of these conversations right now. So putting that in place, dialing that back, and just recognizing the grades, the assessments that are coming out of this year are coming out of a very specific pandemic context. It's very different from all of our other metrics in other years. So just hold those really lightly. And we don't have long-term studies of kids coming out of a pandemic and what that means. We don't, all of the research has been done in non-pandemic conditions. And so look at the kids in front of you when you get a chance to really assess what their knowledge and skills are like in a more normal environment. That's where to put some of that attention. So that would be the second thing. And then just for the third, demonstrating that pandemic resilience and learning. I think the flip side of making sure not to say to kids, you got to hurry up and make sure that you make up for this time, is saying, wow, wow, look at all you've done. Look at all we've done. Parents who got your kids on any Zooms, or who got your kids to wear a mask or any of these things. This is amazing. All these teachers who have been doing so much. This is amazing. To celebrate it, to applaud it, and to give it meaning. I mean, this is an amazingly hard thing that people have done in the interest of saving lives. And so young people can take this hard situation and wrap it up into a sense of meaning and accomplishment, rather than just deprivation, because the deprivation and the grief of lost experiences is there. But a collective positive meaning-making experience can, I think, really help. And then, like Sharon said, drawing out some of those lessons learned. What have you learned about the way you learn? What have you learned about yourself during this time? I think is really helpful. So, that checks a lot of boxes. That's social emotional learning, that's resilience, that's primary mental health issue prevention. And it's also the kind of healing and recovery that I think will help to keep kids engaged and frankly help our educator workforce that's also exhausted at this time.
Wow, thanks, Kate. That was very insightful. Jason, I'd like to get some of your perspective. What were some key points that the students made about their experiences this past year that you think will resonate with organizations and professionals working in communities to support students and families? What's your take?
Thanks, Eric. First of all, I think we have to look at this from the perspective of this is an unprecedented collective trauma that everyone is experiencing. And professionals and caregivers and teachers and parents, we can't say to the youth, I've been there before, because none of us have really been there before. And we're all going through this trauma. So I just want to back up though quickly and say, that kind of segues into my next point though, is, we really appreciate the work that WIPPS has done and Sharon has done to get this project from concept to reality in a very rapid period of time. And it's because the work, the results, the reports need to be in the hands of the mental health and substance use, from our perspective, mental health and substance use professionals, the schools, the teachers, the community, because it's now is the time that we actually have the ability to take some action and pivot our approaches to meet the needs of the kids, of the youth. The value of the report, as it really is as the report states, or the title states, it's hearing directly from the youth. The youth voice is so essential to making a healthy and robust children's system of care, or improving that system of care, or adapting practices to meet the needs of the kids. I think the report shows in many instances, just like Kate said, one of the most key takeaways I have, and I think that this would apply to the mental health and substance use providers across Wisconsin, is the youth have found ways to be resilient in this time of a collective trauma. And that I think that comes out strongly in those comments too. In the actual quotes that Sharon included in the report, Sharon and her colleagues included. It's important for organizations and professionals to use a strength-based approach. And so one of the key takeaways I have is, upon initial, as professionals are working with youth who may be experiencing a mental health crisis or increased substance use, is definitely start with that strength-based approach and highlight those resilient type practices that the youth have taken on and developed on their own. On the reports, I'm sure we could put a link or something, but on page 5 of each of the reports, the big reports, the high school and middle ones, readers can find a list of the key points, but the ones that I think resonate with organizations, professionals working in the communities to support students and families are the following. I have a handful of these. Number one, the high levels of stress and anxiety the pandemic has caused. In some cases, the pandemic has exacerbated their existing mental health and substance use challenges. And that I think we all intuitively thought that perhaps, but this really came out strongly in the report itself. That the youth have experienced, either directly personally or perceived through seeing their peers, an increased use in drug use, including alcohol and vaping products or tobacco products as well. And so as professionals, that needs to be taken into consideration, that there's an increase in that use, and whether that's be directly a result of the pandemic and what the kids are experiencing? And will that be lowered over the course of time as the pandemic restrictions lift? That remains to be seen. Virtual learning continues to be a struggle for the majority of the focus group participants. And I realize now many schools are going back to some hybrid or full-time in-person learning, but that really has had an impact. And just like Kate said, I think we can't dwell on the grades parts, but nevertheless, the kids are feeling that anxiety about lower grades, feeling left behind. Will I get into college? What are my ACTs or SAT scores going to look like now that I've basically not skipped a year, but had a whole year of my life directly impacted? Decreased motivation too. This one is actually personal for me. I have a son he's a soccer player, but loss of connection to peer groups and sports teams and sports clubs and those kinds of activities. I don't think we can say enough about how important those are to kids. And even one thing that came out to me in the report is the connection to teachers. We don't always think of that being a key person in someone's life, but those connections to the teachers is so important. And that loss of connection was kind of played out in the report too. And then the final one is the loss of typical academic structure and connections to teachers and school staff. That structure, that daily structure of getting up. And I realize, I agree, I think Sharon said that one of the key points is, they felt better being able to sleep in a little bit, but nevertheless, there's that structure that they no longer had. And in some cases, the structure changed 4 or 5 times over the course of the year. And that can be pretty unsettling. So my final point though is, mental health and substance use providers, as well as the school mental health staff, need to consider these challenges the youth are facing when providing the services and supports. The pandemic needs to be considered, like I said at the beginning, a collective trauma, and providers should take a strength-based and trauma-informed approach when working with kids moving forward. Thank you, Eric.
Great, thank you very much, Jason. We've been talking a lot about mental health already, but Sharon, I want to ask you, what did you learn about in your discussions with students about their mental health and the nature of the stress and anxiety that they may be experiencing? And then I'm going to direct a follow-up to Linda. But what did you find as you were conducting the research? Hope you're on mute.
You're still on mute, Sharon.
Sorry about that, everybody. I'm trying to toggle here. I apologize. So I wanted to build on a couple of things that both Kate and Jason said and focus on some of the things that we learned about student stress and anxiety from a different perspective. I think, as I mentioned, many of the students that we talked to had been learning virtually, but I think it would be a mistake to kind of dismiss some of the findings of the report from the perspective of, well, kids are going to be returning to school in person, so maybe some of that stress and anxiety will go away. I think there's a lot that we learn from students about some of the factors that are contributing to stress and anxiety that are associated with returning to school in person that I think can perhaps provide some information to help guide those decisions going forward. Many of the students that we talked to who had either were anticipating going back to school in person about the time of the focus groups or had just gone back to school in person, they wanted reassurance from their schools and school leaders about what safety protocols would be in place with respect to trying to keep them safe during, learning during COVID. And they also wanted consistent enforcement of whatever the school's policies were with respect to safety, that would help signal to them that, returning to school in person could be done so in a safe environment. And many of them had concerns about, can I return to school safely? Many of the students at both the high school and the middle school levels expressed some stress and anxiety about what they perceived to be their loss of people skills and ability to be around other people after such a prolonged period of, being safer at home or being in smaller groups or maybe just being with their family. There was one student that we talked to who had just happened to be at school the day before that we did the focus group because they had to take a test. And she described a feeling of having a tightness in her chest and, a pit in her stomach, just going back into the school environment. And having to reacclimate to being around other people is something that, was causing some students some stress and anxiety, coupled with, from their perception, a loss of study skills. And the reality is a lot of the students that we talk to, while they care very deeply about their grades, about their learning, about, wanting to keep up with their classes, some of them had, resorted to maybe taking shortcuts and getting their work done as a way to help alleviate some of that stress. And regaining those study skills and trying to keep up with their assignments, in a in-person environment was something that they were concerned about. And I also think it's important not to forget the stress and anxiety that students who might have to stay virtual because of their own personal health factors or because of family factors, that's almost an added stress on them because they have this fear of missing out when they see their peers returning to school in a situation where they may have to stay virtual, almost, increasing that inner turmoil that they may be feeling about just, being back in school and wanting to be back in school. So I think, with May being Mental Health Awareness Month, it's kind of a perfect time to be having some of these discussions about student stress and anxiety and realizing that, just getting kids back in the classroom in person isn't necessarily going to mean that a lot of the things that they were describing are going to go away.
Great, thanks, Sharon. I'd like to bring Linda into the conversation here. Even beyond the results of the research that we're talking about here today, we're hearing a lot in the news about the mental health of young adults during COVID. And as Sharon mentioned, with May being Mental Health Awareness Month, did the findings of this study mesh with what we're hearing in the news recently? And what are some of your biggest concerns as they relate to the mental health of students?
Yeah, I think that what we heard from the students in this study is very similar to what our office has been hearing with the students that we've been in connection with. Soon after the pandemic started and schools started being closed, we held our first listening session with youth to talk about mental health generally. And the students expressed a lot of the same things that Sharon heard in her focus groups. And we, in terms of what's going on in the media, the data on 2020 is still coming in. It's still pretty new. We do know from one study that came out last month that examined private health insurance claims, billions of them, that there is, the data from that study show that there's been 100% increase in terms of anxiety and self-harm by students in Wisconsin. And we know that that Wisconsin is among the top states in terms of self-harm by kids. So self-harm is something that is typically found in girls, and it's disturbing because it's really, kids are, with those kind of behaviors, they're showing us that they're struggling. So we know, in part from some of the data that Kate collects for us through the Youth Risk Behavior Survey, that anxiety and depression, feelings of sadness and hopelessness, continual feelings of sadness and hopelessness have been increasing for Wisconsin students. And this has been going on for a decade already. So that kind of information that came through in the focus groups, it really does mirror what we've already been hearing by kids. At the same time, I would support the others who have talked about the resiliency factors that we heard from kids. We hear that too. We hear that they want it. One of the ways that I hear resilience is that they are telling us, we want to have easier conversations about mental health. We want to be able to have them at school. We want teachers and other school staff to be equipped to have conversations with us. We want stigma to be reduced. We want to know enough about mental health that we can be good support to our friends who are having issues, because we all know that teens are going to go to their friends before they go to anybody else. Some of them will go to their parents, but that network is really important to them. And that's one of the things that the pandemic has just really interrupted for kids, is their social support network, their friends, their teachers. I think Sharon has said that the students realize that they care more about school than they thought they did. They want to be there because it's a place to be, to learn, and to be with their friends. So we are really, as an office with our collective impact network, are really going to focus on social connectedness, because we think that this is a key factor for what needs to happen now that we're starting to get back to normal. That we have to consider kids wherever they're at, recognize that they come back to school from different experiences of being home, different levels of comfort of being home or at school. We want to greet them wherever they are and help them feel connected and feel like they belong.
Thanks a lot, Linda. And I'm really glad you brought up the Youth Risk Behavior Survey. And I know Kate's really kind of in charge of that. And we were just talking about that before the show and the real importance of that survey. So we're looking forward to that getting started again in the fall and seeing what comes out of that. But I'd like to continue on this theme of mental health. And I think, Linda, you really touched a lot on this question, but I'd like to hear from others and any other perspectives you have. So we'd like to know if, we're hearing from health professionals, as you said, Linda, we're hearing from parents, we're hearing from students about the challenge of mental health, and in particular, the lack of resources around mental health for young people, and the stigma that you mentioned that surrounds mental health issues. So did this study talk about that at all, Sharon, or did the students rather in this study talk about that? And what did they have to say?
For the high school students that we talked to, and in many ways the middle school students as well, stigma was identified as the main reason or the main barrier that they expressed in terms of being able to ask for help with their mental health and wellness when they needed it. So this study confirmed, what I'm sure Linda would tell us, is a significant barrier to people getting help, is those feelings of fear, embarrassment, or shame associated with asking for help really came through in our conversations with the students.
So I'm kind of curious for all of you, what do you think that we are learning from this, and what can we do, as a state to provide more resources or to make more resources available, particularly around mental health for our youth and the families looking for support for their children?
So if I can just speak for a minute to the mental health professional shortages, our office does regular fact sheets, and we did one recently on the mental health professional shortage. Our entire state does not have enough mental health professionals. And this is, it's not just Wisconsin, this is across the country. So we really need to look at, there are many things that need to be considered in terms of how do we encourage more people to come into the field. There are issues related to training. There are issues related to the pay, that people are not choosing this field. So for me, as we continue to work on those long range issues, we have to also think about what are we doing now and what do we have at our disposal now that we can help to create support for kids and help turn around this lack of access to treatment. One of the things that I think we need to look at more intensely is peer support organizations. So there are Hope Squad and Red Green. There are several groups that encourage young people to come together at school and support each other. And I think where we see kids who are involved in one of those organizations, they are more hopeful, they are less afraid to speak up, And we also see that where we do have school mental health programs going, the students are engaged, and once they become engaged and they feel that therapy is working for them, that it turns things around for them, and they will often refer their friends to the therapist, or say, you could go get help with this, or, you know, this is what I can do to support you.
Any of our other guests have thoughts on this topic?
Yes, I mean, really, Linda's point about the mental health shortage is just key. I mean, we know, and DPI is one of the agencies that has been, you know, working hard on this issue as much as we're able to, and making great strides, but there's still so far to go. It was interesting and disappointing to see in the report that a lot of the students, when asked about school-based mental health services or mental professionals, that didn't come to mind for them. They kind of drew a blank in a lot of cases. And I think, you know, one of the things that we've heard in other student focus groups pre-COVID is that they like a lot of the adults, they like a lot of teachers, they like their counselor, but people are too busy. So they, you know, maybe that first pass would have been talking to the art teacher after class, or my husband's a physics teacher, and even a physics teacher sometimes has kids come up to him and talk to him about things that are worrying them. That might be the initial referral pathway. But again, if those educators are too stressed, then that pathway gets interrupted. The kids pick up on the stress. One other thing I just say quickly, I should make a plug, is that DPI has put together options for schools to spend COVID relief money, and we have mental health support listed on the webpage, and how schools could use it for that. So I think that's a policy-oriented step.
Thanks, Jason. Yeah,
thank you. I think part of what we're doing, part of the answer is what we're doing right now. First of all, is it's really a catalyst for conversation between organizations, including DPI, DHS, Office of Children and Mental Health, Children and Families, Department of Children and Families, Department of Juvenile Corrections, all of those. This really has to be a catalyst for those kinds of conversations, because it really has to be, and it has to be like a multi-tiered approach at the state level, at the policy level, at the federal funding level, and how those federal funds come into Wisconsin and then get dispersed and disseminated, but then also at the local level and down to the local provider level too, whether that be the county or tribal governments, all the way down to the individual school-based counselors and the mental health counselors and the substance abuse counselors across Wisconsin. At DHS, some of the things that we are doing as a result of receiving additional federal money that's dedicated to COVID response, we're increasing funding for, just like, and one of the things that Linda had said, this is for parent peer supports, but we are increasing money for parent peer supports. We know more can be done for youth peer supports or peer supports amongst youth. We're increasing funding for primary substance use prevention for kids across Wisconsin. We provided additional funding to 211 as well, 211 to expand their emotional support opportunities. Now that's not dedicated just for kids, but that applies to everybody. And then we're also providing additional funding directly to counties and tribal governments, so they may increase and develop their own services based upon their own community needs, which is part of the Wisconsin model where we have, county home rule, and that's key to getting the services that those counties need at the time. So, again, we know we can do more, and we're continually exploring those opportunities for support and expanding services. And conversations like this is where it really gets started.
Thanks, Jason. Dave, just have one quick follow-up for Sharon. Sharon, I'm curious, from what you heard from students, did they have any ideas about how to access resources or improve resources around mental health they're different from anything we've heard so far?
Well, I think one of the key points that could be taken away from this report is that the students want to be asked. They want to be involved in the discussions that we're having about solutions, as opposed to, the adults assuming that, XYZ is going to be what is going to be received best by the students. I mean, the kids that participated in this project, and I don't think they're materially different than other kids in Wisconsin, They were extremely articulate, extremely insightful, and had very well thought out perspectives on all of the topics that we covered. And they just want to be asked. And they want channels to provide input into things related not only to mental health and solutions for providing mental health, but on just all of the things that are impacting their lives. So my hope is that this report will provide even more of an impetus for school leaders and communities and governments and agencies and parents to just take the time to ask kids what they think and be part of the process of designing solutions for some of the things that they said are important to them.
And Sharon, that actually leads perfectly into my next question. I think we'd all agree that the research did a really great job shedding light on the challenges that exist on so many different levels, right? So my question, Sharon, yeah, and you've already started to answer it, I think. Were there any positive takeaways from the study? I mean, did students have anything positive to say about their experience during this in this COVID environment that we've all been coping with?
Yeah, I mean, that's the good news, is that across the board, all of the students that we talked to could identify some new coping skill that they had learned or developed as a result of the process of dealing with COVID. And for some students, that could be the development of a new hobby or a skill, or increasing their physical activity, spending more time in nature, spending more time with their family. And many of the students had developed a greater sense of self-awareness as a result of this process, and had learned things about themselves that they could take forward, as they, grow and move on with their education and beyond. I think the kids really developed a greater appreciation for their family and for their friends, and in particular for their school. And some of them expressed this from the perspective of, you don't really know how good something is until you don't have it. And I think that was a really hopeful perspective, is that clearly many of the kids that we talked to were struggling, but at the same time, many of them were so determined to want to be successful and get through this. And, that it didn't matter if they were in northern Wisconsin, the city of Milwaukee, Madison, La Crosse. What we heard from the students was consistent, that they want understanding and they want to get through this. And knowing that they weren't alone in this process really helped them, even just through the process of participating in the focus groups, realize that some of the things that they were experiencing weren't all that different than other kids across the state. And so that helped them a lot.
If I could just follow up on that, I would say those themes that Sharon identified are really what we've heard when we've convened youth to talk with us. The excitement that they feel about being finally in touch with other youth who are thinking about these things they're thinking about and caring about it and wanting to make a difference, and wanting to be heard, and doing that in really pretty sophisticated ways. They're, this is not simplistic thinking. They are really thinking about, this is what we need to make this better, not just for me, but for, my friends, for my younger siblings. And, one of the ways that we are hoping to contribute to that is that we're working with DPI on a mental health curriculum. And so there, this fall, there will be available a curriculum for health class that will be available for the for elementary, middle, and high school on the basics on mental health. And we'll be including lots of information and ways for that kids are going to learn about mental health. And we hope that it's going to facilitate some of those easier conversations that they're telling us they want to have. I think they're really telling us we want to get to a new normal when we come back. And it's something for us to listen to. I will also just make an announcement right here on Two Ball Guys that our office is going to invite Jason, Kate, Sharon, and a number of other departments representatives to come together and really have some in-depth discussion about this report and start thinking about how do we respond and how do we move this from understanding to action.
Fantastic.
Dave, I noticed we have an audience question. Should I go ahead and ask that?
Oh, yeah, go ahead. I missed that.
So someone's asking, how is the report shared with current school staff? And beyond reading the report, this person says, I think this discussion should also be shared. Your panel's insight is invaluable.
I think Kate might be in the best position to ask about how we can get this out into the hands of school staff. So I'm going to let Kate answer that.
Yes, I can tell you what we've done so far and open to other ideas as well. So it is something that that I have shared on my listserv for the Youth Behavior Survey. So it's a lot of directors of student services, school counselors, community leaders with ties to schools, etc. But that's kind of a group that already is paying a lot of attention to student well-being. Also, through we can disseminate it through those professional organization lists of school psychologists, counselors, social workers, and nurses. And so, to date, we've sort of just been pointing people towards the report. Like Linda said, there are ongoing discussions and opportunities to keep conversations like this going.
And I'll add too that when the reports were initially released on, let's see, it looks like around April 20th, we also have large listservs that people would subscribe to. Now you have to actively subscribe, but I wish our communications person were on, but I think these listservs, we pretty much clicked every single button that we could that we thought was relevant, and it went out to thousands and thousands of emails across Wisconsin. So that was another way that we distributed, and that went out to, whether it be mental health substance use providers or people in CCS programs and coordinated services teams, initiative programs. So all different folks in all different professions across the state.
And one thing I'll add is that I hope that, right now we're kind of in the dissemination phase of this project, getting the report and getting the information out there. And it's my hope that by getting the reports out there, we can shift to the action phase and using the information to have these kinds of conversations today, both at a high level, but also at the individual school level or in the individual community level. And these reports are available to the public and are easily shared. Anyone can go on the WIPPS.org website and download the reports or forward on a link to anyone that you think needs to see them and start having conversations about them. So it's a great question.
Well, thanks very much, Sharon. And I think that's a great place to maybe end. We're really running out of time here. And I also wanted to mention that I believe Luke posted a link to the reports in the Facebook chat as well. So I just want to say thank you so much to all of our guests today. Thank you for taking your time out of your busy days. Thank you for the work that you and your organizations are doing. It's really helpful, informative, and quite frankly, we need you to get back to whatever that new normal is going to be, Linda, as you put it. So we're looking forward to that. And we want to just express our apologies to our friend and regular guest, Dwayne "The Rock" Johnson, for running out of time, but we'll certainly see him next week on the show. And Dave, it was great to see you, and I look forward to seeing you in a couple of weeks for our next program.
Yeah, thank you, Eric. And I too would like to thank our guests for being here. I think this was really an incredibly insightful discussion. And I want to thank all of you for the leadership roles you play in your respective agencies within state government. So thank you very much for your service. And I'd like to encourage our viewers to please join us in 2 weeks for yet another amazing episode of Two Bald Guys. Thanks for being here.